coming up on What Women Want to Know.
I know a lot of people that have suffered from mental health illnesses in Nigeria, and they've just blamed it on the devil. It's just what they've done wrong, or the enemies that are trying to attack them spiritually, and then they take that person to a church and it's about, let's pray out this demon. It's not mutually exclusive. You can do both.
I'm your host, Dr. Adana, and this is What Women Want to Know, the show where we navigate the complex, fascinating, and sometimes intimidating world of women's health and well-being. Here, we create a safe, judgment-free space where no topics are off limits. We confront our fears, we embrace our vulnerabilities, and we find humor in the unexpected. Welcome to What Women Want to Know. I'd like to announce a trigger warning. As this video is about mental health, we will be discussing topics such as anxiety, depression, self-harm. On the show today, we're addressing a subject that resonates deeply within the heart of women's health and well-being: mental health.
Oh God, y'all, I said that word. Mental health.
Mental health issues.
Helping my mental health.
Managing your mental health.
Mental health.
We won't deal with the mental.
We'll explore the barriers and stigmas surrounding mental health, especially in women of color, and the impact of societal pressures, cultural taboos, and the often silent struggle many women face. The goal of the conversation today is to enlighten, empower, and encourage open discussions about mental health. With that said, I'm honored to welcome our guest today, Dr. Jessica Katanga, a medical doctor working in psychiatry whose passion for mental health is profound and inspiring. Dr. Katanga is an advocate for mental well-being, dedicating her career to understanding and addressing the unique mental health challenges faced by women, particularly in the context of racial and cultural disparities. Her research has delved into topics like dementia, with an upcoming study on maternal mental health in Uganda as part of the NHS Global Fellowship Program. In her dedicated YouTube series called Taboo, Dr. Katanga harnesses the power of social media to challenge mental health taboos, educate the public, and foster a society where mental health is openly discussed and valued. What women want to know. It's so lovely to have you on the show today, Dr. Jessica Katanga.
It's lovely to be here.
Amazing. So the topic that we are going to discuss today is one that's very serious. As you know, mental health is a big one. It's a big topic that has been mostly plagued with all of the stigmas and the taboos, so much so that people don't openly talk about it. But I personally felt that during the pandemic and the way that that whole period just affected so many people's mental health. And also the fact that it's just a new generation, one of openness and people tapping into their vulnerability. People are sharing and being open more and more about the challenges that they're facing with their mental health. I mean, this is the field that you work in. Let's start off with your inspiration. What inspired you to choose psychiatry?
That's a great question, actually. And it takes me back to when I was in sixth form and I was volunteering with people who had dementia. So then I was thinking, okay, how does the brain work and things? And I thought, okay, I'll do psychology. And my mum said, no, everybody does psychology. You could do medicine.
Of course. The African parents, thought it was just Nigerian parents. I think it's the whole continent.
the whole continent diaspora. So then I was like, okay, I'll go into med school, and I was interested in neurology first. But then as I was doing all these different placements, I just kept on seeing mental health come up. And even though it came up in every profession, in every sector, the doctors and surgeons kind of like to skirt around it. And I was just like, I feel like we're missing a really key bit. And then from there, I just kept on reading around it, and it just kind of grew and grew and grew. And I was just like, yeah, psychiatry is for me.
You know, psychiatry was actually one of the specialties that I genuinely thought that I will devote my entire mission to. And
similar to you, it was the intrigue of, how does the brain work and what are people thinking? Can I read this person's mind? It started off with that sort of curiosity. And then in med school, I thought, I really want to take this seriously. My first attempt at going into mental health was then doing a research at Harvard University. I did a research on schizophrenia actually that summer. So I moved to Boston and I did this. It was a very renowned psychiatrist and I learned so much. And I came back with all of this ambition that I'm going to be a psychiatrist. And for me, I really wanted to be a psychiatrist because what I had learned in med school about mental health, I realized that was the complete opposite of how we approach mental health in Nigeria and in Africa. Okay. So for me, the goal was learn everything and go back and change the country. Obviously, the idealism that we all have when we're growing up. So I set up this foundation called Mental Health Initiative for Africa, MIFA. And this was in 2011 or 2012. But as I tried to start the conversation, I think this was even pre-becoming a proper content creator. As I started the conversation around mental health back home, the conversation wasn't flowing. There was a block because the way that we perceive mental health was just, they're mad people. Oh, this person's crazy. Oh, did you hear that person went crazy? Like all of these things we know now, whether it's psychosis, bipolar, any of the spectrum, mental illness was not approached the way that I thought would give me confidence to practice in that specialty. And then I navigated. So really intrigued by, like you that had that passion and you still kind of stuck to it. Yeah, I love that. So in your experience, what are the most common misconceptions about mental health?
The biggest one that I can think of is that if you ignore it, it will go away. Number two would be that it's, it's a defect or it's a fault in the person who's experiencing the mental illness. And three, that probably like in psychiatry, all we do is just throw medications at you. But no, I've seen that it's like a mental health nurse, the psychology, it's counseling, it's so much that goes into it. So I think that would be the top three misconceptions.
With most misconceptions, right? It is a fundamental of education and awareness or to verify they're uncomfortable with, what they don't know. Your opinion, how can that change? Or do you even think it's changing? I personally think it's changing. When I about 10 years ago, now the can we do more of? I think we can even increase that awareness.
It's spot on in terms of we vilify what we are uncomfortable with. And sometimes we also vilify things that we can see within ourselves, because if we address the mental illness there, then we might have to address it within ourselves as well. And I feel like that can sometimes be the generational. I'm sure we can talk about that later. I definitely think it's taken leaps and bounds. With mentioned the pandemic earlier, a time where we was kind of like forced to reflect of people disrupted our busy lifestyles. It made us stop and think, is everything that been doing or that we've been doing in society, do we have to still do it the same way? And then it was such a high stress and it was everybody in it together that I feel like it just couldn't be ignored. In terms of what we can keep on doing moving forward, I think that all the, as I share, anxiety, we can put bipolar in there sometimes. I feel like that we're getting a handle on. There are some more meatier ones like psychosis, schizophrenia, anxiety disorders that feel like that are still very vilified. That it's a journey of how we evolve the conversation around mental illness.
Think about those diagnoses that you've just mentioned in the context of same communities, right? Like Black, Asian, minority, ethnic, studies that come up. And I think one recently that you mentioned that was done at the University of Cambridge that showed that young Black females are the most common group to be admitted to A&E for self-harm. And you look at the communities where mental health is not as acknowledged or dealt with. What thoughts on that?
So that study from Cambridge that yes, in terms proportionally A&E, people coming in with self-harm, Black women are overrepresented. But then when it comes to long-term engagement with mental health facilities, we are underrepresented. So it's saying something of that we only maybe as a society face our issues. It gets to crisis point when it's breaking point.
The context of cultural attitudes towards mental health, right? I do come from a society that does not acknowledge mental health as much as
here in Western society, because the blame is on the person. There is the shame that the family feels, a lot of stigma around mental health conversations that it's acknowledged. So question really is, can we break those barriers within our communities?
One is it's opening the conversation.
Yeah.
To education, I don't mean it in a condescending way, just in it's an openness, lots of things that come into it. And one of the things, as you said, pride, shame. I come from, the family is going through something, then you have to go through it as a unit, and you don't talk to people, because, you don't want people talking about you, or you don't want to bring shame to the family and things. But really, when you do that, then is somebody supposed to get help for their parent, or somebody supposed to get help for their child, Such a shame that we do have such a strong sense of community, kind of like office level community, through vulnerable community, where you don't just gather or when it's good times, but also where you really trust that your sister, auntie, uncle, wider family can support you in those times. People maybe think of it as maybe spiritual versus mental health, whereas I believe that with these things you can combine the two. So it doesn't mean that you're depressed, or if you're going through this, that just something you can pray away. Yes, you can of course always speak spiritual counsel, but then also these things have to be addressed through counseling, medication, sometimes through therapy.
Exactly, like practical steps. And I think you've just highlighted really the reason for these cultural barriers. Like a lot of it is spiritual, a lot of it is society. You don't want people saying bad things or knowing the family secret, and in doing that, depriving someone of the help that they need.
And of course, can we improve this inwards and say, what is our society doing? But then we also have to look at the context that which we live. So unfortunately, maybe if we're thinking of, let's say, British people, statistically, maybe we might be in jobs that we can't afford to take the day off, or childcare, so that you can be a new mother with postnatal depression. Well, who's going to look after the children whilst you sad kind of thing? So sometimes we don't even have the time. But we live in a world where kind of have to be really productive and things, and then if you are Black or if you are African, that can be amplified.
What women want to know. That's a bridge to the thing that you had referenced earlier, which is saying that although study would show that women are the most common group admitted to A&E for mental health illnesses, statistically we're the ones least likely to help from the system. So to understand whether systematically because of so many other socioeconomic factors that would then prevent the BAME community from seeking mental health support, or is it a racial prejudice that when this help is sought after, we're not taken seriously?
It's definitely both. In terms of when now we go out to seek help, or so for example, if we say, as I mentioned, postnatal depression earlier, and every GP, when the baby checks at like 6 weeks, to go through the screening questions for the baby blues to the mum, and they've seen statistically that a GP is less likely to go through that with a Black mum or with an Asian mum sitting there so we're not even being asked the questions at the same rate as our counterparts. And number two, yes, people's experiences of health services with physical pain, our pain is not always believed. Then now no wonder how we might be treated with emotional pain. Definitely people's experiences, they've been negative, they're extremely valid, but I would just want anybody to not be discouraged at the same time, because only is learning and wants to be compassionate and knows that we need to have services towards all of our patients.
What other changes do you think is needed within the healthcare system to support mental health in diverse populations? One is staff training. You've just mentioned, like if you're going through a questionnaire that's there and you're not asking certain individuals, but you're asking the others, obviously there's a lot of training around biases. Why is that? Any other things that come to mind as far as improving the mental health support for minority population?
Yeah, I would say sure that people have placements in more like diverse areas. So I remember my GP placement, it was an area where it was just Asians. I kid you not, it's so of me or anything like that, but I did not know that Asians have the same family problems as we, like as in people coming in with addiction, psychosis, family issues, and I was just like, from the outside, you don't know what's going on in other people's societies. So I think definitely just experience and exposure was a really key one for me.
It makes you look at things from a different perspective, right? Realize that we all have the same problems. We do.
Exactly. You only need to see it once, then you're just like, oh yeah, of course we all have the same problems because we're all human.
Education is a big one. It's a big one for you. I know that you I mean, I suppose by standard Africans, we love education. We love education. We love education, right? Take it back to the education system, and the roles that schools can play in bringing or awareness conversation of mental health. What is the best way to approach that conversation?
A great question. Now, a thing called spiral learning, where you every year or so you visit the same topic but in more detail, and that's how it gets embedded. So I feel like we need, from nursery times, how do you know there's a problem if you can't even name it? So let's first tell people, how do we name emotions? Show happy faces, sad faces. That's what you might show in nursery. And now maybe in year 4 you might say, oh, when you feel this emotion, you can think about why. And so I think definitely emotional awareness training, empathy. For example, in high school or in university, how do you spot signs that your friend might be struggling? Go to uni, normal partying, and what is a bit more worrying behavior. And that would a huge difference in just in that conversation, just a normal.
Yeah, there's definitely a gap in the education for sure, because as far as the happy face, smiley face and sad face and emotion, like my kids come back from nursery with those photos, so I'm well aware that they're teaching them. But like, they then progress further, like when we get into school or university, I feel like there is that ache in how important should we drive the conversation of mental health. I mean, the research is there, especially with the rise of social media. There is a lot more young people suffering from more mental health illnesses, whether it's depression, anxiety, not fitting in or not belonging, right? Spectrum. There is other very big mental health diagnoses, and there is like most common ones being anxiety and depression. There's someone watching this video who has no idea to spot depression themselves or in someone that they love. How can you educate us about it? The definition, what are the signs to look for? How can one take care of themselves?
In terms of depression, it has to be long-standing, so that's defined as like more than 2 or 4 weeks. As low mood, low energy, and you're not interested in things that you normally would do. It can then go on to affect your sleep, affect your appetite, affect libido, so you can't think of the future. And fullness is also a really big one. So I would say that in terms of yourself or your friend, the biggest thing is if they're becoming a bit of a recluse or they're not participating as much, that would be a really big red flag. And you can just ask them, what's up, how have you been feeling?
Contrast anxiety. Do you then describe anxiety and what to look out for as well?
Anxiety, if we think about generalized anxiety, which is the anxiety is disorders, but the ones that people usually referring to when they're saying anxiety is generalized anxiety disorder. And that's just a constant feeling of something's going to go wrong, that something's not quite right, overthinking this, overthinking that. And a lot of people, we only ever have one brain, so there's no kind of like comparison. How do you know that, oh, I thought everybody just always locks the door 3 times, or everybody know that no, that's actually not normal, and you can have a brain that is not and a mind not full of noise. Tell people what the red flags are. We're really wanting to go deeper and understanding. I think therapy, if available to somebody, is great, because it's just like brain is such a powerful machine. We all have, like, for example, like iPhones in our pocket or smartphones, capable of so much. For example, a machine like that, just a smartphone, has a manual guide. What more for our brains and minds, which is a powerful machine, to the infinity compared to a smartphone. So having like a therapist, that can just guide you through that and instruct you on use your mind this way and kind of get rid of any glitches you might not even be aware of.
Pro therapy. I'm very pro therapy, and I'll tell you honestly, for the longest time, I thought therapy was only for people who had a diagnosis, who had problems their lives and who had difficulty navigating life. And I think it was a lot of my own biases as well. Now, you have a therapist, something that I say very openly, and I will tell you that it wasn't for me to say that openly, because I even thought that me saying that I'm doing therapy gonna open me up for people judging me that I do have a mental illness that I don't have. I mean, stigma is just all around us when it comes to topics like this. The pandemic really did a number on everybody, but I found that the most powerful thing to come out of that was vulnerability, like people saying, oh, okay, seeing a therapist, and then advocating for therapy even and you don't believe that there is a problem at that point. Describe, our brains as machines. Like you really do need to offload that at some point on somebody that you trust. So I'm pro therapy as well. Let's talk about maternal mental health. And I'm bringing this up not only because I'm a mom, but because I know that you are going to Uganda very soon to carry out this research project on maternal mental health. What was the inspiration for that?
So I'm very excited about one, and it's this thing called like NHS Global Health Fellowships. Literally a friend that DM'd me saying, oh, they saw this project and it sounds up my street. I just like clicked on the page and then saw that it was about like psychiatry and women's health, and I was just like, well, that's
is right up my alley.
And then I applied for it and I got it, and it's taking a locum year, so like a year or two out of the training pathway. And this book called The Pathless Path, where instead of like going a path set out, a lot of us kind of like climb this ladder, climb this slippery pole to the top. This is more about kind of just following your interests and allowing the world to present opportunities to you. So
I love that.
So sometimes I'm like, I'm really leaving the country for 6 months, like why did I do that? And then other times I'm like, just bring it on.
So I take it that this is your first research project or clinical experience outside of the UK since your training in psychiatry. I'm gonna ask, like, how do mental health challenges and solutions differ, especially in places like Sub-Saharan Africa compared to Europe? But I don't know if this is a comparison that you'll only be able to make after you're done, or do you have any insights already?
I come from Tanzania originally, and pretty often there I like to kind of visit hospitals and just kind of just talk to people,
or follow traditional people into the jungle and get iodine to like rub on your skin. I watched that video and I thought that was just brilliant.
A lot of fun when I went to Zanzibar, the spice farm, and just seeing how different societies and things. When I was asking a nurse that works in Tanzania, saying that that I am also wanting to specialize in mental health here in the UK, and she was just like, there's mental health in the UK. And I was just like, huh? And she was like, I thought all of you guys, they think there is the land of milk and honey.
Oh my God. Oh my God. Everyone has their ish together. Do you tell her that? Do you tell her no?
I told her the truth.
You told her the truth? You just popped that bubble.
Again, it's just the human experience, like, anyways. There's definitely, I also do some, like, I just read about things. So like with now increasing urbanization, and Tanzania has a very young population, and the increasing urbanization, we're seeing now more teens getting addicted to street drugs and things like that. So Tanzania does realize, of course, that there's a mental health problem. There's psychiatrists there, but I think that the need to supply is kind of like mismatching.
Why maternal mental health specifically? Besides the fact that was the opportunity that presented itself with the fellowship, and you then decided to do it, what was the curiosity?
With my interest in mental health and women's health, and then also my research background is in like dementia, and then when I did a placement F2 for psychiatry, that was in a adult female inpatient. So that's like, I was just like, I actually quite like younger and younger, so this is showing me adult psychiatry, so compared to old age.
You see patients, like, have you been confronted with maternal mental health in the course of your practice?
As I said, I worked in an adult female inpatient ward, so some of them have very, very severe depression. So it's not necessarily that they've worked with people who are postpartum, but giving birth or matrescing a mother, such a lots of women go through, and such a profound effect that has come into some of my patients' history as to where they had bouts of depression in the past, etc., etc.
What women want to know. Three kids, and my first experience with mental health, I sat back and I myself, you are going through something, you need help. I only made that respectively after the birth of my second child. I was just nonstop. And the thing is, I wouldn't just wake up and cry. It was just, there had to be something, but I was just constantly triggered. I was unhappy. And it was difficult for me really admit to myself that, hey, this might be postpartum blues or postpartum depression. I had never experienced anything like that. And, I consider myself very driven and very ambitious. The fact that even being a mom in itself, the one job that really slows you down, really, it makes you just realize that it does not start and end with you. Like, you now have responsibilities. Seeing David, my husband, continue going to work, and it just made me jealous. I felt angry, and that jealousy and anger me also cry a lot. And then I just realized that even the jealousy, the anger, the tears, patience, the frustration, everything, signs of pattern blues and pattern depression. And that's something that I had to admit to myself when I came out of it. So unfortunately, I didn't seek help whilst I was in it. That made me struggle for a lot longer. And the thing about that was making sure that I was very aware of my mental health, having my third child. I think big one. I'm really curious. The results of your research, especially from the context of sub-Saharan Africa. I really want to understand who men present themselves. Like, what would make a woman in Tanzania to the GP or come to the hospital to say suffering or I have a problem, help me? My personal curiosity anyway. So that into one of your research questions so that you can answer it when you're down.
Thank you so much for sharing your story and into the kind of anger and irritability. I don't think a lot of people realize that those can be signs of depression. Sometimes also the media or what we think of, it's not always sad. Sometimes it's you find yourself being irritated at things that usually would just, if you're back angry, you're just not the person that you feel that you naturally are. So I feel like you set some people free with that story.
And actually, I wanted to touch on anxiety because that's also something that recently struggled with as well. Remember earlier this year, I saw the signs. Worrying. I just felt was doom and gloom lurking in the background. Every time I would feel this way, I would always try to excuse it with just being protective of my kids. If I'm worrying too much about work and success and finances, excuse is, well, I'm doing this to secure the future of my children. It was this doom and gloom. I just always thought like, things up, something bad's gonna happen, so I'm going to be jinxed. I couldn't sleep. Normally, I don't even sleep that much. Yeah, I'm very hyperactive. I have so much energy. Literally went through this period where I was sleeping maybe 2 hours a day, stressed. Appetite was affected as well. I suffered for a few weeks, and I remember sitting on my bed telling myself, Adana, to break down this ego that's making you think that this is normal, and go to your GP, need help. I'm putting on my jacket that day thinking, but yes, I'm just going to do it. But I know that nothing's wrong. I'm just being protective of my space and my career and everything. I went there, pulled out this 7 form, this generalized anxiety disorder 7 that goes through a list of 7 questions. And the highest score. She's like, excuse me, like I'm diagnosing you with generalized anxiety disorder. And hard for me to hear because they say doctors make the worst patients, right? For so many reasons. First of all, you're the last to seek any help because you think
all. I mean, I could have tonsillitis, coming out of my throat. I'm like, I'll be fine. I know I'll be fine, with that attitude of, things need to be really, really broken for me to fix it. It's really a difficult diagnosis to get. Always the conversation of medication, which is something I want to explore with you. I've had friends who have been diagnosed with depression and they have struggled with medication because of the side effects. It does help. I'm not saying that medication doesn't help. There is the element of melancholy, like it makes you very down and you lose your personality. These are the common layman feedback that I hear from my friends. What was your take on medication?
With medication, a lot of people can be hesitant towards it. Yes, there are side effects, and I think it's maybe when people hear other people's stories and they're just like, I don't want to go through that. The stigma attached to medication, or no, I'll figure it out on my own. The way that I think of it is, for example, if you have a broken or sprained knee and you take paracetamol is then to help you to engage in therapy, the physiotherapy. So I think it's the same way with antidepressants, anti-anxiolytics, that you take those so that you then can engage in the real work, which might be therapy, which might be living life,
So
which
it's a
might
bridge.
be bridge. Yeah, exactly. So that pandemic I really went through it, and I was so, and again, being a high achiever, being a black woman, being a la la la, I was so tearful. I was trying to revise through tears, like it was just ridiculousness. And I went to my GP, and then now I was able to take the antidepressants, and yes, I got some weird dreams and appetite. It was just like, wow, I can now engage in this thing called life, and I can actually, I feel like I'm back in. I'm no longer on the bench. Definitely just try things. Everybody reacts to things differently. Always something else that one can try. It be for you, it might not be for you, but rule it out before one's taken it.
I mean, the key thing that I've taken away, and for people listening, that medication really can serve as that bridge that you need to hop onto the other side. So it guarantee that you would take it forever. It's just you do need it now, engage in it now. But we keep saying the stigma around mental health is not just the diagnosis, it's not just the therapy, it's also the medication, right? There is just a lot of stigma that, someone's taking antidepressants. And I think those stigma can really prevent a lot of people from engaging in really need them. Yeah, thank you for sharing that. What is your hope for the future of mental health? We go from here.
Hope for the future of mental health is that we colonize it entirely. We understand people's different cultural contexts. Access to psychiatry is fair globally, that we just remove the stigma around it. So I just hope that there are services that are there, available and robust to treat every patient, and that every patient feels empowered to access those services when they do need it.
Okay, that's amazing. And what about in the context of Africa?
I hope that the stigma around mental health can be reduced. I hope that we can name things by their proper names. So somebody on the roadside, or just that mad person or that crazy person, it's either addiction or it's psychosis, or I hope that we can start naming things as they are, that we can start about it plainly in our families, within our wider communities, that also see it as a complement to spirituality rather than as an enemy to spirituality.
That hit me deep. Maybe because I'm African as well. Because I love people that have suffered from mental health illnesses in Nigeria, and it just blamed it on the devil. Just what done wrong, or the enemies that are trying to attack them spiritually, and then they take that person to a church and it's about, let's pray out this demon. Mutually exclusive. You can do both. And that does not take away the religious aspect of really cleansing oneself. If we don't acknowledge that this could be a mental health illness, then people just don't get the treatment that they need. And that's a disservice for sure.
Definitely, and especially when, for example, things like addiction are that, drunkenness is a sin, then how can somebody then come up openly and start asking for help for addiction? Because you've already villainized them.
God, that just hit me. That's another one that actually just hit me. Especially drinking alcohol, right, is considered a sin. Someone then is intoxicated all the time, considered useless or just a waste of space or he's gone mad or the things, except his addiction. Like, people also get addicted to alcohol, not just drugs, I'm gonna be the bridge between and what's happening on the ground in Africa. So after your research, I'm coming to you with all tell me all the findings.
Update you on the tea.
We're coming to the end of this conversation. What advice would you give to listeners who may be struggling with mental health issues or who know someone who is?
Advice would be that there's nothing wrong with you, that mental illness is not a personal failing, and you can live a life is much more better and free, and you're deserving of that type of life. That would be my advice.
So you go by this mantra, self-care is healthcare? There was this mantra.
Self-care is healthcare.
Yeah, self-care is healthcare. What were self-care tips you do for self-care? Actually, not even the tips, because it's very easy to dish out tips like do this, right? Lay out. What do you do for someone who has a busy career? You also do research projects. Busy. What do you do for self-care? What do you do to preserve your mental health and well-being?
I make sure that in terms of my day job, I work 4 days a week rather than 5. I have routine and plan and prep, so stressed out in the week. I try to make sure I have like cooked meals and things.
That's one sure way to eat healthy. It's really that's the trickiest bit. You come back from a full day of work or you're tired, and it's easy to grab the closest thing to you, which unfortunately might not be healthy. So that's a good one.
I have an app which like checks in on my emotions and things.
Really? You need to share that app.
How we feel. Amazing. It's really, really cool. Not know how you're feeling, so it helps you to find those words in the first place. So that's very cool. Been to therapy as well, so that really helped my emotional well-being. I also read a lot of like different like self-help books and things, manifestations and mantras and things. Like I have all these quite a hippie around in my house. So.
I love that. I feel like I'm a hippie as well. Maybe that just like has to look proper sometimes, but like deep down, I'm hippie to the core. I have manifestations, like 6 steps to success, like affirmations hanging around everywhere. I love it. I really sharing all of your self-care and well-being tips. The one that I'm most intrigued about is the app, which I've never heard of. Anybody needs any new apps, but I mean, this is a good one to download. Check that out. It's been a pleasure to you this time. Thank you so much for taking the time.
Thank you for having me.
You all the best on your journey, and especially the exciting project that's coming up in Uganda.
Thank you so much.
All right, I'll speak to you soon then.
All right then.
Bye. Bye.
What women want to know. Thank you again to Dr. Jessica Katanga for taking the time to come on the show today, share her insights to mental health as an illness. Health is a very important topic, but unfortunately, surrounded by a lot of taboos and a lot of stigma, and people don't seek help enough. Suspect that you or anyone you love is experiencing any of the symptoms of a mental health illness. Advisable that you speak to your healthcare professional. There's no reason to suffer alone. Your mental health is important. It's okay to talk about it. Find all of Dr. Katanga's information down below in the description bar. If you're watching on YouTube, you can follow her on every social media platform where she shares insights and educational content around mental health. Big thank you to you for tuning into the show today. If you're watching on YouTube, don't forget to subscribe and turn on your notifications so that you know when a new episode goes live. It's every Sunday at 6 p.m. GMT. If you're listening on Spotify or on Apple Podcast, to leave us a review and to follow along, because your feedback helps me to improve, makes me understand what sort of conversations you want me to explore on the show, but also it helps more women find us and who need to be part of these conversations. Don't keep us a secret. What women want to know with your friends and your family, not just the women in your lives, also the men as well. For that, you can find us on every social media platform, so make sure to follow along. That's our show for today. Remember, your health matters and it's okay to talk about it. Until next time, I'm Dr. Adana, and this is what women want to know.